Hello, I'm Dr. Inman. Most of you know me. This is a short video on toenail fungus or foot fungus, essentially. Fungus grows on devitalized tissue that doesn't have any blood supply to it, essentially, and also its ability to grow in that area also devitalizes more tissue, so it continues to devitalize tissue and grow into that tissue. The problem with treating with antifungal medications that are orally taken is that there's no blood supply, so we end up with this zone, like no man's land, of devitalized tissue that the fungus continues to grow in, and it'll move up the toenail. This is like toenail fungus. The other point I would make is that when we see it in the lamina of the horse, essentially, we'll see it essentially as a condition that undermines the area of the actual, sorry, go away. And we see it underlying those areas and basically produces a misshapen hoof, which is essentially the fingernail. The most common condition that we treat with fungus and the technologies that we have here are, in fact, the toenail fungus that we see in human females, essentially, or in humans, etc. And I'll discuss that in a minute. But like I say, there's all kinds of lotions and potions that we put onto these conditions, essentially, and trying to make them go away, and they're very ineffective because you can't really imbue that into where the fungus is. It's basically existing in a cocoon of dead or devitalized tissue under the toe, and basically is very difficult to treat. Well, what we do and what we've done in the past is we've utilized laser therapy as a means to kill the fungus, especially when they'll move through the tissue. We use the Arconia devices. The Arconia Corporation spent a huge amount of time and effort and money in doing the research to prove that electromagnetic radiation at a specific frequency would kill the fungus, essentially, and allow the nail to grow out. So the Arconia devices has worked, essentially, but not as good as the devices that we use now. So we use the foot fungus general, essentially, toe fungus general on essentially the toenail, essentially, for 60 seconds, and then we repeat it again about an hour later, and that's about all you really need to do, quite frankly. It's one of the few things that respond as effectively as this does. As a matter of fact, the Arconia Corporation's created a specific instrument that they provide for podiatrists, essentially, to do just exactly that. That's all they do with it. It's expensive, but basically that's what it is they're delivering, and we're delivering this at about anywhere from 275 to 375 milliwatts, essentially, for 60 seconds using the 16 different frequencies that we have. The Arconia devices can only deliver 4 at a time, but we deliver essentially 16 different frequencies in 60-second period of time times 4 run-throughs, essentially. Now that is what happens. Now I live with 3 women, all of which cannot survive without their toenails being painted. And then invariably they'll take their toenail polish off and realize they've got a fungal infection underneath one of their toes, usually the big toe. And essentially what happens is we then go ahead and laser them a couple times, leave them unpainted, if you will, for about a week, and then then they can go ahead and do whatever they want to do after that. But we very commonly will repeat that maybe 6 months out for a couple of laserings too, to make sure it goes away. During that period of time, the misshapen toe has to grow out, and this is the bad part about toenail fungus, is that once we easily take care of toenail fungus with this particular device, the toenail has to grow out, which could take 8 months to a year before you have a normal toe nail, essentially. And it's the same thing with the hoof that'll have to grow out of the equine. That'll have to grow out too, and it'll take a while, and sometimes up to 2 years before you end up with a normal hoof wall, because it grows so slowly. The same thing with Paryonchitis that we see in the canine and also in the feline, essentially, although they respond a lot faster. We're talking about 2 or 3 months for the horse. I'm sorry, for the cat and for the dog when they end up with a fungal infection in and around their toes, essentially. And this is the therapy. It isn't any more complicated than that. 60 seconds, do it twice, and then you're good to go. Very commonly we will chase after it maybe 3 times a week for a couple weeks to make sure it goes away and put everybody back to rights. But that's essentially how it is that we take care of that. Keep in mind that there's a fungus that's growing on devitalized tissue. Blood therapy antifungals that are taken orally are worthless because there's no blood supply there. They're cocooned to the point where topicals almost never work, even though they're advertised on TV all the time, essentially. And this is a way for us to take care of toenail fungus and foot fungus in the dog, cat, horse, and human in an effective fashion. And one of the things you should be using, essentially, in this, if it occurs to yourself, this is the solution. But remember, the client needs to know that as soon as we treat them, they're probably on the healing cycle right off the bat, but it's going to take months, 8 months or longer, for them to have a normal toenail, essentially. And the question is, can I still have my nails painted, the women will say, and the answer is yes, we laser right through the toenail paint. And also people will, believe it or not, put acrylics on their toenails so they have a beautiful shaped toenail. We can laser through that too. That's not a consideration. Infrared laser absolutely does not work here. However, the frequency-specific laser, and the frequencies are 784, 230, 304. They are 363, 20.5, 666, 1698.6 essentially, 73.24, 667, and 343, and a couple other ones. Basically that are included in the protocols here that are delivered as a group, and their group is much more effective. So if you have any questions about toenail fungus, I don't pretend to be a human practitioner, but we treat a lot of fungus, subcutaneous fungus essentially, in the distal extremities of dog, cat, and horse. And feel free to contact me, area code 208-640-3430, or you can email me at drbill@vomtech.com. That's VOMTECH.com. I'll be happy to try to show you how it is that we do this. This particular YouTube video is designed to instruct the people who have the laser. If you don't have this laser, I'll be more than happy to show you how to get hold of one. And it is available to all practitioners and to all paraprofessionals and consumers too at the same price. So you can contact me at the telephone number and I can show you how to go about and take care of this condition. Virtually every podiatrist and every person that does pedicures should probably have one of these devices. Should pay for itself in about a week. Anyway, this is Dr. Bill Inman. Thank you for your patience and have a super day.